And for women, breast cancer mortality is higher than any other demographic. As we move into Breast Cancer Awareness Month, it's important to shed light on this disease. Joining us now to discuss that is Dr. Anita Somani. It is a pleasure to have you. Welcome to BNC.
Thank you.
So while the mortality rates continue to fall, new studies show that Black women in the U.S. are more likely to die from breast cancer than other groups. Why is that? Why are we more prone to die from this disease?
So I think the biggest issues are the access to care. When you think about access to care for African Americans, there's a disparity in terms of how easy it is for them to see their primary care physician. They may not have the ability to get there because of transportation. They don't have doctors in their neighborhood. There's a delay in their getting mammograms, whether it's because of health insurance or, again, making those appointments, getting those regular screening mammograms. They may be more worried about getting them because of the cost. So I think those are things that we have to look at in terms of disparities when it comes to mammograms, screening exams, breast exams for African Americans and for other minorities.
All right, so Dr. Somani, what are some of the early signs that we as women should be on the lookout for?
Yeah, so the thing about mammograms that's really critical and really important to realize is that you will detect breast cancer in a mammogram almost 10 years before you feel a lump yourself. So breast exams are very important. And oftentimes people say, I don't know what I'm looking for. I don't know what I'm checking or how to check my breasts. And that's not as critical as knowing your own breasts. So doing a breast exam regularly, doing it the week after your periods. That way, you don't have as much of the tenderness, you don't have as much of the discomfort, and it's easier for you to feel. If you feel a lump, if you feel something different, go in and see your doctor, go in and see your primary care physician or your gynecologist and have them check it. Don't take no for an answer. If you're worried about something and you feel like the doctor is dismissing you, then still pursue that. Ask for a referral, ask to see a breast surgeon. Simply, getting a mammogram or an ultrasound. Mammograms can miss some lumps, so an ultrasound can be very helpful in addition to the mammogram. Other signs are pretty vague when it comes to breast cancer. It's not like what you just reported on lung cancer. There aren't as many symptoms. I think one of the first symptoms is a woman feels a lump, and that's what brings her in. But if you know you have a family history of breast cancer, starting screening at a younger age based on the age of the youngest person in your family that had breast cancer. So if you have someone in your family who had breast cancer at 40, you want to start your screening exams at age 30, 10 years prior to their diagnosis.
Dr. Somani,
Yeah,
excuse me. Can we just talk about how we need to advocate for ourselves? Because you mentioned if you have a mammogram, you have the right to request an ultrasound. But is that covered under most insurance plans? Can you just tell us how we need to advocate for ourselves if we feel we need additional screening?
Right. So an ultrasound is not necessarily going to detect cancer, but what it will do will help the doctor to determine, is it a fluid-filled cyst that you're feeling? Is it a solid cyst, more likely to be a tumor that you're feeling? So that's where an ultrasound can help in addition to the mammogram. So again, advocating by, if they don't find anything on the mammogram and you're still feeling something, that's the perfect time to say, well, can I get a breast ultrasound? Would that help in terms of what I'm feeling? Oftentimes we'll refer patients to a breast surgeon because they're the right person to see in terms of getting a biopsy of that lump, whether it's fluid-filled or solid. The breast surgeon is the person who's going to be able to help determine the difference between that being a benign tumor or a malignant tumor.
All right. I just have one quick question for you, and if you could answer it briefly. How often should we be giving ourselves a self-examination? You mentioned after your period a week, but how often? Twice a year, 3 times a year, every month?
So that's a good question. We used to recommend self-breast exams every month. There is controversy within the healthcare community about whether breast exams are helpful or not. I think initially doing it once a month is helpful because then you know what you're feeling in your breast, you know what feels normal to you, and then you may be able to better recognize what feels abnormal. Having a breast exam once a year with a physician is really important because they can add to the exam that you've already done and see if they feel anything differently.
All right.
So the two together I think are really critical. And then, as I said, early screening. You know, if you have a family history of breast cancer, most breast cancers occur in the postmenopausal age group, and those are not usually genetic or hereditary.
All right,
So
Dr. Somani.
that's not as much of a concern.
I'm so sorry. We don't have enough
That's okay.
time. We got to bring you back because we're going to be highlighting this subject all month long. Thank you so much for that great information, Dr. Somani. We look forward to welcoming you back. We'll be right back.